Hello, my name is Carmetta Murphy, and I will be presenting my MSN evidence-based educational project on preventing end-stage renal disease amongst African American males/veterans aged 50 years and older. Kidney disease affects many Americans. African Americans are 4 times more likely to develop kidney failure. Prevention and management of kidney disease is vital. My background notes that my population of interest is African American males/veterans aged 50 years and older. They have a higher incidence of health problems, a neglect of health, and poorly managed health conditions. Nationally, African American veterans comprise 12% of the veteran population. 7.6% of Alabama's adult population are veterans. 67% of the Birmingham, Alabama population are African American. African American veterans have poorer management of chronic disease compared to non-Hispanic European American veterans. The issue of concern is the lack of knowledge on chronic kidney disease and the interrelationship amongst hypertension and kidney disease. This contributed to poor management of kidney disease and led to the delayed diagnosis/treatment and poor patient outcomes. Many African American males lack chronic kidney disease knowledge. The lack of knowledge led to disease progression. Nationally, 37% of end-stage renal disease patients in the VA health system are African American. In Alabama, kidney failure is 4.3 times greater amongst African Americans. African American veterans are twice as likely to progress to end-stage renal disease. A review of literature was conducted. In the article entitled Kidney Disease Knowledge in African American Males, Robertson and Daniels identified a lack of knowledge regarding chronic kidney disease. They highlighted the need of chronic kidney disease education amongst African American males. Yan and others investigated the prevalence of kidney failure amongst African American veterans after the onset of chronic kidney disease and the role of age. The results revealed African American veterans were younger than European Americans at the time of chronic kidney disease onset. The findings highlighted the importance of acknowledgement and early CKD intervention. In the article entitled Perspectives on Racism in Health Care Amongst Black Veterans with Chronic Kidney Disease, Jenkins and others investigated the socioeconomic element of racism amongst Black veterans with chronic kidney disease in the VA Medical Center clinics. Institutional racism was noted in the association between low socioeconomic status and CKD prevalence. In the article entitled Clinical and Economic Impact of Early Diagnosis of Chronic Kidney Disease in General Practice, Pesse and others evaluated the clinical and economic impact of a targeted training intervention for practitioners to enhance chronic kidney disease awareness. The results highlighted that the intervention improved awareness and knowledge and early CKD detection. In the article entitled A Scoping Review of the Role of Health Literacy in Chronic Kidney Disease Self-Management, Shaw and others examined the relationship between health literacy, knowledge, and self-management of chronic kidney disease. It was highlighted that disease-specific knowledge is important for health literacy. It is also noted that health literacy is essential for effective self-management of chronic kidney disease. A needs assessment was conducted and a gap analysis was performed. The identified gap notes that many African American males/veterans have no knowledge of kidney health, chronic kidney disease, or end-stage renal disease. A SWOT analysis was also performed, which displayed the strengths, weaknesses, opportunities, and threats associated with chronic kidney disease in African American males. The windshield survey took place in Birmingham, Alabama, and it displayed several things, some of which were fairly clean living conditions, health and wellness is encouraged in the community, as well as a population health and well-being ranking that's slightly above average. Key leader and informant interviews were also conducted. 2 healthcare professionals in Birmingham, Alabama were interviewed. Key issues of health and wellness were identified. 2 concerns noted were patient engagement and health knowledge/education. It was noted that patient engagement aided in patient education and knowledge. Theoretical framework. The nursing theory used for this project was the self-care theory/self-care deficit theory of nursing. It was developed by Dorothea Oram and promoted self-management/self-care. Self-management/self-care was imperative regarding chronic kidney disease management. Chronic kidney disease education encouraged learned self-care behaviors. The borrowed theory of constructivism was also used. This is an educational learning theory which focuses on active learning. Active learning was required with patient education on chronic kidney disease as it aided and encouraged self-management. Active learning is necessary for chronic kidney disease management and end-stage renal disease prevention. Environmental, individual, and agent factors associated with chronic kidney disease. Environmental factors consist of socioeconomics, poverty/improper housing, and inadequate nutrition. Some individual factors, such as immutable characteristics, are African Americans, being a male, or lifestyle factors such as inactivity/obesity. Agent factors consist of chemical agents, which are air pollution and contaminated water. Primary, secondary, and tertiary prevention were also used. Primary prevention was centered on disease prevention. Strategies focused on increasing awareness and education for those at risk. Secondary prevention was centered on early detection and treatment. Strategies focused on screening and treatment/management in early stages. Tertiary prevention was centered on limiting disability from disease. Strategies focused on treating the disease that is already established. Evidence-based education project plan. This was an educational program on chronic kidney disease. It was tailored to African American males/veterans aged 50 years and older. It was centered on the disease process and the management of chronic kidney disease. Incorporation included the patient, family, and community population. There were 3 community diagnoses identified: neglect of health related to low health literacy, increased risk of chronic kidney disease progression related to inadequate management, and deficit knowledge related to lack of information/education. The priority community diagnosis is identified as the deficit knowledge related to lack of information/education on chronic kidney disease, evident by poor disease management and disease progression. Population interventions focused on patient education and improved management/prevention of disease progression. Using the 5 sub-roles of the Advanced Population Health Nurse to promote Healthy People 2030, as researcher, risk factors/causes of chronic kidney disease were identified. As clinician, the at-risk population was identified. As educator, teaching on chronic kidney disease was provided. As collaborator, there was work with other healthcare professionals. As advocate, there was support of chronic kidney disease learning and management. 5 sub-roles promoted the Healthy People 2030 objective of reducing the rate of new cases of end-stage renal disease through investigation, assessment, teaching, collaborating, and advocacy. This produced improved patient education/management. It also provided prevention/delayed disease advancement thus reduced new cases of end-stage renal disease. Measurable plan objectives were that 90% of participants were able to define chronic kidney disease in their own words, identify and define their current stage of chronic kidney disease, explain chronic kidney disease management, and demonstrate self-measuring of blood pressure. Resources and a budget were also constructed for this project. A timeline was also established for project content and implementation. Barriers and challenges during this project. Lack of benefit felt by patient is noted as a barrier, as some participants felt education was not beneficial since they already have chronic kidney disease. Challenges such as appointments as education conflict is noted, as many veterans had several appointments on the same day, which affected appointment time and teaching time. Project implementation. Implementation location consisted of the VA outpatient clinic and the VA community clinic. Participants included the patients, family members, and the community members. Content which was given was focused on disease process of chronic kidney disease and end-stage renal disease, including the 5 stages, estimated glomerular filtration rate, chronic kidney disease and end-stage renal disease management, and self-blood pressure measurements. Teaching strategies / materials used were handouts on chronic kidney disease and end-stage renal disease and self-blood pressure measurements, videos on chronic kidney disease and end-stage renal disease, and blood pressure machines were used for hands-on teaching of self-blood pressure measurement. Self-reflection on the project. After reviewing the project, it is noted that the project was well organized, it was clear and structured and comprehensible. When learning from a project of this magnitude, the importance of planning is noted, as well as the importance of high-quality research. If something had to be done differently, 10 to 15 minutes would be added to the appointment time to account for late arrivals and the loss of time. A new idea, if the project were done over, would be for the request for no other appointments on the day of the CKD appointment. This would aid with the late arrivals and appointment delays, which are caused by veterans having multiple appointments on the same day. Project evaluation. Participant learning was evaluated using the post-education questions. These questions consisted of: what is chronic kidney disease? What is end-stage renal disease? What does the estimated glomerular filtration rate measure? How many stages of chronic kidney disease are there? What stage of chronic kidney disease do you have? And what are some ways to manage chronic kidney disease / end-stage renal disease? Can you explain / demonstrate how to correctly measure your blood pressure? Participant learning was also evaluated using return demonstrations / the teach-back method and post-education questions, which involve subjective patient feedback. Measurable outcomes were that 90% of participants answered the post-education questions correctly, which included return demonstration. Future recommendations. Project recommendations would be for permanent placement and implementation of this project at the VA Chronic Kidney Disease Clinic. Implementation outside of the hospital or clinic setting would be great, as project information could be used at health fairs, churches, and in rural communities. Expansion of this project by healthcare professionals by adding sections would aid in the project sustainability. In conclusion, looking back on the information shown, one can see that there was lack of chronic kidney disease knowledge amongst African American males / veterans. This lack of knowledge led to poor disease management and the development of end-stage renal disease. The focus of this educational program was to prevent disease advancement. The implementation of this project improved chronic kidney disease knowledge, management, and delayed / prevented disease progression, thus improved patient outcomes. This last slide is my reference slide. It has all of my references that were used for this project. It is listed under my reference QR code. I would like to thank everybody for their time, and I hope you enjoyed my presentation. Thank you so much.